Do you sometimes feel a bit blah? No matter what you do, just blah. You may have tripolar disorder. Don't worry, we've got a drug for that. Side effects may include anxiety, delusions, hallucinations, emotional numbing, uncontrollable shaking, weight gain, mania, psychosis, suicidal tendencies, homicidal ideation, panic attacks, and paranoia.
From the age of 10, docs pumped mind-altering meds into Adam Lanza. Pretty much every school shooter in the past decade was on prescription drugs. On antidepressants, kids are 10 times more likely to get violent. Suicides are even more widespread.
You take a mortal man, you put him on psychotropics, have him play violent video games, and join the military. Starts to hear voices. He gets through 2 checkpoints because he has a top secret security clearance. Shoots a bunch of people. So now America has to turn its guns in. Because Dianne Feinstein has the moral high ground. Just like Nazi Germany, they'll take our guns. Because Obama loves the children, turn in your guns right now. Acting like a robot.
Politicians forcing Pharmageddon on Americans.
How about Prozac? You know the number one, oh, that's the big sponsor, isn't it? Or that whole class of drugs.
Let me ask you a question.
Oh, gotta cut that off, don't you? Don't want to talk about the U.S. number one cause of death is suicide now because they give people suicide mass murder pills.
Calm down.
Your answer is give more money to the psychiatrists and psychologists to put more crazy people on drugs that make them kill people, Pierce.
To feel good.
Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. In depressed patients, worsening of depression, including risk of suicide, may occur. Alcohol may increase these risks.
When a mother chops her kids up with a cleaver because she's on serotonin...
Tell me why I'm wrong.
Why don't you want to get rid of the drugs? Because they're half your sponsors?
Suicide and malformations the mainstream media won't report because for every dollar drug firms spend on research, they hand out 19 times more to media on commercials. Big-Pharma shills an astonishing $100 billion on ads to brainwash you into buying. Top spender is Pfizer with this notorious antidepressant Zoloft. Mainstream media gratefully pockets the fortune, and who cares about the viewers?
The industry is responsible to Wall Street.
America's number one cause of unnatural death now is suicide.
Alex,
not automobile accident, not cancer, not...
You
Listen,
accuse me of attacking the Second Amendment of the Constitution.
I want to get people off pills that the insert says will make you commit suicide and kill people.
Alex, let's get about to the Second Amendment.
I want to blame the real culprit. Suicide pills. Mass murder pills.
Okay.
In your son's situation, I would recommend that we go with medication. We can start him off with these. Side effects include mania, aggression, hostility, psychosis, homicidal ideation. At least 8 of the recent school shooters have taken these. Let's see. We've got Springfield, Oregon school shootings, the Red Lake, Minnesota school murders, and, the Columbine massacre. But it's really up to you.
Have you been diagnosed with depression and struggle with sadness?
Maybe you're scared of being criticized.
Ask your doctor about Effects or Exile.
Ask your doctor about Symbol.
Talk to your doctor about Zoloft.
So talk to your healthcare professional.
Your doctor today. Your doctor. Tell your doctor. Contact your doctor immediately. Talk with your doctor.
Every day, psychotropic drugs cause serious adverse reactions.
And while psychiatrists and drug companies fully understand the dangers of the drugs they sell, their unsuspecting customers are left to suffer the consequences.
Everything became worse. Each mood swing was worse.
He would have chronic headaches, chronic, nausea, not feeling good.
She was very agitated, very, very jumpy.
She was having horrible hallucinations. Her personality was disintegrating.
Once he started on that drug, the cloud just stayed over him and stayed over him and stayed over him. It got darker and darker.
He thought there wasn't anything worth living to kill himself. That was not Matthew. That was the drugs.
At least I would like to have said, I love you. I didn't get a chance to do that.
In addition to crippling scores of people daily, every month, psychiatric drugs kill an estimated 3,000. But the human devastation would never have gotten this high if psychiatrists hadn't worked hand in hand with drug companies to promote their drugs to doctors throughout the world. Today, 70% of all psychiatric drugs are prescribed by general physicians. And how is this accomplished? Marketing.
It's about creating a good story that uses science, that convinces a physician to think about writing a prescription.
This is not science. This is incredibly effective marketing. It has nothing to do with science.
They use what I call statistical contortionism. Basically just skew the numbers, make everything look fantastic. You hide the bad numbers.
They're learning every trick in the book. They're evolving into efficient marketing machines, and it's working.
There's definitely an unholy alliance between psychiatry and pharmaceutical sales. That's a marriage made in heaven.
They're like conjoined twins. They're joined at the wallet.
And with 374 mental disorders filling psychiatry's diagnostic manual, and more on the way, business is booming. Pharmaceutical companies have expanded their roster of psychotropic drugs from 44 in 1966 to 174 today. The top 5 psychotropic drugs combined gross more money than the gross national product of each of over half the countries on Earth. Altogether, the psychiatric industry rakes in $1/3 of $1 trillion a year. How could this have happened? It's a tale of deception that may be difficult to believe, but fatal to ignore.
The never-ending saga of the SSRI prescription given to young people that for some stupid reason they know it's not good. It's just like as the world turns. Joining me again is Dr. Linda Lagemann. Good morning, ma'am. How are you?
Good morning.
When we left off last week, we were talking about young children, like baby children, not able to sit up yet children, no teeth in their head children, being prescribed SSRIs.
Yeah.
Now, I don't want to know the stupid reason why some parent or some doctor would put them on that, because it's stupid. There's no justification for that to me.
It's true. Mm-hmm.
What does this do to this baby?
First, let's back up. because SSRIs, let's start even before, in the womb. SSRIs, pregnant women are told these are safe. These are a drug that pregnant women are told are safe to take while they're pregnant. They are not, and there are birth defects that are connected with the SSRIs. And again, all these things are lawsuits about them. They hide stuff, they pay out, but they know certain birth defects. There are a couple. There's one that the lungs of the baby don't develop. They can't really function outside the womb, and so you have kids that die, right after birth and this is a known thing. It's called pulmonary hypertension, but it is caused by SSRIs in utero. And then you have kids born, and they are addicted to SSRIs. And we've talked a little bit about how difficult they are to withdraw from. Well, these babies are born in withdrawal syndrome, with high-pitched crying, eating problems, which is serious when you're an infant, like agitation. They're in pain. They're in withdrawal. What
kind of eating problems?
Like they don't want to eat. They can't. They don't eat. They don't nurse. They're agitated. They're not going for it. So they then don't put on the weight that you need to as an infant. So there's a whole syndrome that goes with that is this withdrawal syndrome that the kids born to women taking SSRIs suffer through. And so then you get, the kids a little bit older, the ones who are actually put on them directly, which, as you said, is completely insane. There's no justified reason. And the SSRIs, we can look at the immediate effects, while somebody's taking it, the withdrawal symptoms, and then the long-term effects, because we do now know that since these have been around, the SSRIs have been around since the late 80s, and so you have people that were put on them as children in the late 80s, 90s, that now we know what it does to be on it for a long time. So the first things that the SSRIs do, this is also for adults, but we're looking at children, causes insomnia, GI problems, gastrointestinal problems, nervousness. These are some physical things that it causes. Muscle cramps, muscle weakness, seizures, a thing called akathisia, which is a severe inner agitation. This is a key thing. This is the symptom, the adverse reaction to the SSRIs that leads people to kill themselves and to kill other people. This is what leads to violence and suicide. Akathisia it's hard to describe it in words. It's, severe inner agitation, but I've talked to people who've had it, and they want to just do anything to make it stop. They want to get out of their skin. There's nothing you can do to alleviate it. It's inner. Like, you can't work out or go for a run or do anything to make it go away. So those are the physical things. Then the mental and emotional effects of the SSRIs. Massachusetts General Hospital did a chart review. So they went and they looked at all the charts of children who were treated with SSRIs, and they saw that 10% of them became psychotic. Psychotic meaning like they went crazy, hearing voices or hallucinating or, losing touch with reality is psychotic. So 10% of the kids that were put on SSRIs became psychotic. 6% of them became manic, grandiose, hyper, like manic, can't control behavior. And they concluded, that these were disturbing outcomes of worsening emotional, cognitive, and behavioral symptoms that were significantly impairing. So here you take a kid and you, for whatever reason you think you need to be on an antidepressant, which is, ridiculous to start with, but trying to help. Somebody thinks they're going to help this kid, and you cause this. You make them go crazy, you worsen their emotional, cognitive, behavioral symptoms so that they are now impaired. And we're going to come back to this in terms of the creation of disability, basically the destruction of ability that all the psychiatric drugs do, and, we can trace that. Going off of them, then we have the severe withdrawal symptoms, which is why people find it very hard to go off, and increased violence in the withdrawal phase. That's also where some of these violent episodes happen, is in the withdrawal phase. And GlaxoSmithKline paid out a big settlement because of concealing their own internal studies that showed the increased violence with the withdrawal phase. And so then the long-term effects, like I said, we've had people who are now adults that started on them when they were teenagers or kids. And the biggest thing is the creation of chronic depression. And again, we can go through this a little bit. I can trace the history of how this has developed in the literature, the psychiatric literature. But you have chronic depression because the brain has adapted to the intrusion of this chemical, and it has adapted by shutting down production of serotonin, which is one of the neurotransmitters, and shutting down some of the receptor sites, trying to adjust for this too much serotonin artificially created by the drug. So you get a chronic depression, and then something that the American Psychiatric Association warns about, but they don't stop the drugging, which is what they call apathy syndrome. And that's loss of motivation, increased passivity, feelings of lethargy, like no energy, laziness, and flatness.
Let me get you to hold it right there. We're coming up on the first break, and
Sure.
we'll pick it up at apathy and lethargy,
Yeah.
lethargic behavior. My guest this hour, Dr. Linda Lagemann. We're talking about SSRIs again because you can't really cover it in 1 hour. We were getting down to the lethargic behavior that is a result of certain side effects of taking the drugs. Please continue.
So, yeah, this whole thing they're calling apathy syndrome. That's this loss of motivation, passivity, feelings of lethargy and flatness. Then you've got memory loss, cognitive decline. There's something I'm looking for. Here. Okay, so this is I'm just going to insert here a quote from Aldous Huxley. You probably know this quote. There will be in the next generation or so a pharmacological method of making people love their servitude and producing dictatorship without tears, so to speak. Producing a kind of painless concentration camp for entire societies so the people will, in fact, have their liberties taken away from them, but will rather enjoy it because they will be distracted from any desire to rebel by propaganda or brainwashing enhanced by pharmacological methods. And this seems to be the final revolution. That's Aldous Huxley. I looked for that quote because it reminded me of when I was reading the symptoms of the apathy syndrome. That's pretty serious. And then the other thing is the long-term effects is the creation of bipolar disorder. Since the SSRIs came on the market, 20% of the kids treated with SSRIs deteriorated to bipolar disorder. So bipolar meaning, that manic depressive, highs, lows, uncontrolled, manic and then depressed, just a dysregulation of emotional states. You can track this with also the disability, the Social Security Administration disability rates from when 1987, when they started giving Prozac to kids, and the steep rise in the number of kids on an antidepressant, an SSRI, from in 2004. So it's much more now. I don't have the updated specifically on SSRIs, but in 2004, 1 in 40 children was on an SSRI. That's 18 and under by 2004. So once this steep rise in the use of SSRIs happened in children, there was exactly corresponding a steep rise in bipolar disorder in children. Bipolar disorder in, the 50s was considered really rare in people in general. But bipolar illness has, in 1955, it was a very rare thing. And then from 96 to 2004, the number of adults, we'll go back to diagnosed with bipolar disorder, went up 56%. This is SSRIs. It's because of the SSRIs. It creates, it messes with somebody's normal neurochemistry, and it creates bipolar disorder. So back to the kids, you got this huge, steep increase in the bipolar, same with adults. And then with children, also same with adults, but in children, you've got, again, a parallel, it's the same graph of an increase in the number of children, the rate of children on disability, Social Security disability, for mental illness. Now, the rates of kids on disability for mental illness has really gone up steeply, while at the same time, the number of kids on disability for other causes, other medical causes, has gone down. So we're disabling. This is the long-term effect. It's the creation, the destruction of ability. That's the long-term effect of the SSRIs. And we just kind of ran through that quickly, but I wanted you to get the overall picture of how this happened.
You described a condition they got into where you said most of the spree shooters are involved, and I don't remember the term you used. They get into a condition of. Do you remember that?
Oh, are you talking depersonalization?
No,
or derealization, not akathisia.
Akathisia, there you go.
Akathisia, okay, yeah, akathisia.
Once somebody is in akathisia, if that is occurring within them, if it's happening in their head and everything else, and this would be, I guess, where they are either in the middle of the 5 steps of being an active shooter or they're about to execute their their final plan. Is there any intervention for them short of stopping them in the middle of the act?
Of what to do to help them, like get out of that?
Well, my first thought, if you can stop them before they actually do it, yes, to help them get out of that. That would be my first thought. So is there any way to help them prior to this occurring?
Well, they'd have to be like very, very slowly withdrawn from the drug. The drug creates that condition. It creates the akathisia. It creates a disconnection from other people. You know, there's an interruption of the normal kind of feelings of community and connection with the world and people and yourself. So you've got to get off of the drug. I mean, I think that's the only thing is going to be the slow withdrawal from the drug to get themselves back. The drugs, all of them, all the different categories of psychiatric drugs, disable parts of the brain. That is how they work. They're actually brain damage. You know, the history of psychiatry, is, and to the present, is still barbaric experiment. It's
right.
Now it's mass. People, you know, it looks, you know, it's a pill. But the history of psychiatry, you know, the very first breakthroughs that they had, the treatments, quote, treatments, were insulin comas, where they injected a high dose of insulin, which caused the person to go into a hypoglycemic coma, and then they brought him out of it with an injection of glucose. That was the big treatment. Then seizures, convulsive therapies, drugs, you know, poison, metrazole, which caused the seizure, or electroshock, which is still done today at actually a way higher rate than you would think. The U.S. government spends $5.3 billion paying for electroshock every year. And this is done, one of the big groups this is done to is the elderly. From age 64 to age 65, when Medicare kicks in, there is a 360% increase in the numbers of electroshock done.
Because?
So,
what's it supposed to do for them?
Well, it's supposed to, well, it doesn't, it just damages the brain, but it's used to, they say that it treats depression, they say that it treats a lot of things, but what it does is it damages the brain and quiets the person down. You know, it destroys memory, it destroys brain tissue. You know, you're shooting electric current through the brain. So it quiets somebody down. So when you
to make them less of a nuisance, is that what it's for?
That's right. That's
okay.
Exactly.
Hang on for me. Hang on for me. We're coming up on the next break. That's why I'm working out now, because when I turn 64, somebody tries to electroshock me. Well, they're in for a shock. Getting back to akathisia, I guess my question is the only way to intercede with somebody in akathisia, is the first thing going to be physical confinement? I mean, it's not, it sounds like a very gradual process, but it sort of sounds like you have to have them in a controlled environment in order to do that.
In order to come off of the drug, which is going to be what's got to happen, but you know, you're trying to get rid of the inner discomfort that they have. And some of it might be just help with knowing that having a perspective on what's going on, that can help. Because otherwise the person just feels like they're just like in an agitation, they're just going crazy. So if somebody knew that this is normal, given that you're on the drug, this is what is going on, it will go away. You know, people, when they know something's going to go away, people can tolerate pretty much anything when you know it's going to go away. So some of it just given information, say, okay, this is what's happening. We're going to have to wait this out. And yes, being with the person, getting away from probably all the stimulation, like go camping. But again, it's going to be this gradual withdrawal that needs a doctor. You can't just like stop these things cold turkey. There's a book, Psychiatric Drug Withdrawal, by Peter Bregan. He's a psychiatrist, Dr. Peter Bregan, that tells you how to safely do this. But you need to do it with a doctor who knows what they're doing with this, not the standard taper down over a month or something. It's very, very gradual. But if this would go away pretty soon with starting the withdrawal if it's done gradually. Knowing what it is helps somebody weather it.
Like in the case of Elliot Rogers,
is
there any possibility at all that a police officer could make that call when they do a wellness check on him? Which is essentially what we got right now. That's what we got right now, right? Police can go and take a look.
They did. They did take a look, and he seemed fine to them.
Yes, he was very polite, nice kid.
That's right. And so they can't tell. And I don't think anybody can really tell who's going to get violent. I mean, that's the thing we hear with all of these situations is it's a surprise. Person wasn't violent before. Elliot Rogers, Ivan Lopez, the Fort Hood guy who, killed himself and a number of other people. It's always that this person wasn't violent. So you can't tell. So I don't know. I don't think a welfare check is going to do any good. Welfare checks, what that does, it just leads to people being involuntarily incarcerated and their civil liberties taken away because nobody can predict.
So basically what you're saying is in certain cases, even certain mental health professionals might not be able to make a good call on that one?
No, they're not. They definitely are not going to be able to. The only thing that somebody can do, years ago I worked in a psychiatric emergency room, and no, it's going to be if somebody directly says, so it's not, there's no special skill or something that is being used. It's if somebody tells you, I'm going to kill myself, I'm going to kill somebody else, that's when they get hospitalized or held. But nobody can tell. Somebody can very calmly say, totally fine, I'm ready to be discharged, feel good, and go out and kill themselves or kill somebody else.
Right. Are akathisics normally suicidal as well?
Yes. Akathisia it's just a severe state that is so uncomfortable that it drives people mad. It drives them to do things. Like, they want to stop it. They just need to get out of their skin. So they can get violent because they're so in such an agitated, under their skin feeling, or they kill themselves to stop it. That's the thing that is the key thing that usually is involved in the suicide and violence.
This is why we see so many of them, I guess, commit suicide after their, now is the suicide going to be triggered by somebody showing up that can interrupt whatever it is they're doing?
By somebody who's going to interrupt it?
Yeah, armed person, somebody with a weapon. The second gun in the spring shooting.
Yeah, I think they're going to kill themselves anyway. I think that's part of the whole thing. There's no connection to reality at that point. They're just disconnected from the actual consequences of what's going on. And that's part of what SSRIs do also, is create this depersonalization, derealization, where things don't seem real. So I don't think it's the fact that somebody showed up and is trying to stop them from killing others that causes them to kill themselves. I think that's part of it all along, and it's just just violence going out.
Coming up on the last segment, and we're going to get to the punchline, and I'm just going to ask you one little short question, and you can be thinking about it as far as this goes. Nationwide, mental health wise, actually it's two parts. First question is going to be, if there were no SSRIs, what would actually be effective and take the place for real, legitimate mental health? The second one is going to be, how do we get SSRIs out of the United States?
Okay.
Obama's constantly talking about how the other industrialized nations don't have this. Do the other industrialized nations embrace SSRIs to the degree we do?
No. And that is the key thing. 1 in 4 Americans is on a psychiatric drug right now. 1 in 4 Americans on a psychiatric drug. That is not the case in other countries. We are one of only 2 countries in the world, the other one's New Zealand, that allows direct-to-consumer advertising, TV commercials, print ads, of psychiatric disorders, made-up disorders, and drugs. So we've been bombarded since 1997 when they got Congress to allow them to do direct-to-consumer advertising, the pharmaceutical industry. We all have been bombarded by various ads telling us our everyday human struggles are mental disorders, and the pill's going to help, the pill's going to help. And we really believe it. It's actually, ironically, it's part of why the placebo effect has gone up, because we really believe in pills. That's something we should talk about, too, is the placebo effect, because that's the ray of hope in here. But anyway, no, other countries don't do this, and other countries are looking at America and seeing the mistakes we've made and are trying to, like, halt this. But the drug companies are really working hard to pay people off and to get drugs more used there. Especially the children one. That's one where other countries have looked at how many kids we've got on drugs. You know, ADHD. Most other countries look at the whole ADHD thing and just think it's absurd. It's like it's just childhood behavior.
There you go.
I'm Larry Pratt of Gun Owners of America, and I want to invite you to join the Second Amendment movement with Gun Owners of America, the only no-compromise gun lobby in Washington. Take action by becoming a GOA member today by going to gunowners.org. Gun Owners members receive the GOA newsletter, fact sheets, alerts, certificates, and more. But there's more to joining GOA than just a list of member benefits. The united voice of GOA members has been successful in defeating restrictive legislation designed to disarm our population. GOA has helped get strong constitutional members of Congress like Senator Ted Cruz elected. And with your help, GOA will continue to successfully defend the rights of gun owners in the courts. Participate in our efforts to restore and preserve the nation's right to keep and bear arms. All contributions to our lobbying efforts are used exclusively to support or oppose firearms legislation. Join online at gunowners.org.
If there were no SSRIs in place, if there were no Zoloft, no Paxil, no Ritalin, first of all, is the ADHD such a low-occurring thing that there needs to be nothing to replace them?
ADHD, so there's two things that we're looking at with the SSRIs. They're given for depression, and they're given for ADHD. So ADHD, first, there's a whole category of kids that are diagnosed ADHD. You know, almost 20% of high school boys are now diagnosed ADHD. So there's a whole bunch that are diagnosed where it is nothing more than just the relabeling of normal childhood behavior. And that, you know, now to make money, it's all, you know, these behaviors are lined up and put into a box and called a disease, and then there's a drug for it. So they're just regular kids. That's also why children born in December, with birthdays in December, like first graders, kindergartners, are more likely to be diagnosed with ADHD than other kids because they are the youngest in the class. They are less mature and developed because they're younger, and they're diagnosed ADHD. So that's basically proof that we are diagnosing childhood. Okay, so anyway, so a bunch of them are just regular kids. These are behaviors that have always been around, and you just tolerate it. And kids learn to get control of themselves over time. That's part of, you know, growing up. Then there's some that we do have, I think we do have more of these kinds of things where people have difficulty concentrating, and that, you've got to see what the cause of it is to know how to treat it. There are things that are vitamin and nutritional deficiencies. Our food supply has been so depleted in nutritional value that people have deficiencies that can lead to some of these symptoms of difficulty paying attention. And so you'd have to, you know, see a physician that knows what they're doing with this and can assess vitamin nutrition, vitamin mineral deficiencies. With ADHD, we've got problems in the school system. And so, you know, expecting children, our schools, our courses, the class time has gotten longer and longer, less play time, less outdoor, less running around in nature, you know, being in outdoors in green areas, you know, where there's trees, that has been shown to help with ADHD. But we've got kids, and we expect them to sit still for hours on end. It's an unnatural expectation. And then we drug them when they can't meet that expectation. There's some kids with sports injuries, you know, concussions. That causes the same symptom as ADHD, you know, with the anger, problems concentrating. So anyway, so you got to find what's the source of the problem. Then you problem solve how to fix that. Depression, same thing. First, you got to look at nutrition and vitamin, exercise. is critical. Looking at one's life and seeing what needs to be changed. You know, instead of taking a pill to mask something, it's do a little inventory of your life. You know, do you have people in your life that are bringing you down? Are you not doing work that's fulfilling? Or, you don't just mask it. You've got to, again, look at the source and then problem solve it. Depression, the other thing is when people are depressed because of the way they're thinking, like, their attention is on, past, regrets, loss, shoulda, coulda. One of the best things you can do for depression is get your attention back in the present moment in the life you're living. There are a lot of people who are feeling miserable because they're as if they're living in something that's not currently going on. They're reliving past negative things. Their attention got stuck on something bad that happened. And you have to, whatever way to pull your attention into the present moment where most likely there isn't depression. There wouldn't be if you were actually focusing on your current life. So there are a lot of different things that are effective for depression, for ADHD. It's known that the drugs aren't. Oh, another thing, like I brought up the placebo effect. The placebo effect, there's a lot we could talk about that. It's a whole hopeful, for me, it's a very hopeful area because ultimately what it reveals is our own ability to change our condition by deciding it will be different. There are studies where people, weightlifters, competitive weightlifters were given something they were told was a performance-enhancing drug, and they lift 10% more than they had been lifting before. That's big when you're a big difference when you're a competitive weightlifter.
Yeah.
And then when they were told they were on a placebo, they couldn't lift the weight anymore. And then when they were asked, why can't you lift it? They said, well, the pill didn't work. And this is mind-boggling. Of course the pill didn't work. You did. You were able to lift it. And but if we got back to that belief, knowing that we are more capable, the psychiatry, psychology even, all the labels, the drugs, do the opposite. They tell people that they are not able, they're not capable, it's out of their control, they have a chemical imbalance, there's nothing that they can do except take a drug, and no wonder people start becoming disabled. There's actually a thing called the nocebo effect, which is the opposite of placebo. It's when people that are given a sugar pill, when they have the negative effects, like the adverse, side effects, that's called the nocebo effect. Psychiatric labels are basically a curse. It's like making a person believe that they can't do anything, and then it's self-fulfilling. Then they can't. But the opposite is actually the truth. They completely are in control of their condition and can change it. People have been given a placebo surgery, like an arthroscopic surgery for osteoarthritis in the knee, where they made an incision but didn't do anything. They didn't enter the knee. And those people actually did better, recovered better than the people who were given the actual arthroscopic surgery. That's placebo. That's the person deciding, oh, I am going to be better. It doesn't matter if they think it was because of a surgery or a pill. They decided they're going to feel better, and they made it be so. And surprisingly, some people think placebo only works if you're tricked into thinking that you're taking a pill. There was one study done with irritable bowel syndrome where they told them they were giving them a placebo. They said, we're giving you a placebo, a sugar pill, but because of the mind-body connection, a lot of people get better from this. And so even knowing that they were taking a sugar pill, statistically significant number got better. So we can change our own state. We have to pull ourselves out of this matrix and this thing that we're in that we've been bombarded with, telling us that we're small and incapable and things are out of our control. And we've got to step back out and say, wait a minute, I am much bigger than that. And I am in control of my condition and can change it. For great information, go to cchr.org. I'm the commissioner, which is an advisor for Citizens Commission on Human Rights. That's cchr.org, cchrint.org, and then mine is drlagemann.org, drlagemann.com. Sorry, I'll put it on the, yeah.
Thanks, Doc. Thank you for joining me again.
Yeah, thank you.
All right, folks. We're going to do this again in 21 hours. Between now and then, I want you to remember this. It has never been about gun control, not ever. It's always going to be about total control. On a Wednesday, this has been Lock and Load.
We are in process of developing a whole series of techniques which will enable the controlling oligarchy to get people actually to love their servitude. People can be made to enjoy a state of affairs which, by any decent standard, they ought not to enjoy.